on our own. Okay, so I'm going to train you a little bit on what you can do about sleep and how to prevent, if you don't have now, how to prevent it in the future, because now is the age when we become a little careless about our sleep because we have ample amount of sleep, and gradually we fall into a habit where sleep structures get disrupted. Okay, this sleep, we many people might think it's a waste of time, but it is the only time your brain gets to rest. Okay, people think that I don't sleep, I can work, I can study that time. No, not happening. Whatever you're studying doesn't go inside your head if you don't sleep. I'll tell you a tip why it happens. Because memory consolidation, like what you're studying, like I studied 3 chapters today. If it has to go from your short-term memory to your long-term memory, it goes to a place called hippocampus where it gets consolidated. That organ and the rest of your brain decides, okay, should I make this stuff occupy a space in the brain so that it is recollected later. If it's not important, we just have to chuck it, right? You don't have to waste storage space. So that decision and that process, the process happens during sleep because everything is quiet. Okay, now I will sort my junkyard. So that the brain does during sleep. So if you don't sleep, whatever you study that night, probably you'll recollect a little for your next day, but definitely not 2 weeks down the line. So sleep is good. Okay, so let's get started. I hope you don't think sleep is so good that you fall asleep now. Let's get started. Okay, so there are different types of sleep disorders. Like first, it starts with acute insomnia. Acute insomnia is like short duration. Okay, you don't have to treat it. Maybe a few days you're having bad days. You broke up with your boyfriend, or you're traveling, you don't like where you're staying, or maybe you're at a relative you don't like, so you're not able to sleep in that place. It's a noisy crowd, whatever. That is a few days change, or a life event. There's a death in the family, or you're sick, a life event that disrupted your sleep pattern. Okay, that is acute insomnia. That does not need any treatment, and once you're back, you will be fine. Okay, what is worrisome is chronic insomnia. Okay. Now everybody looks back and okay, I'm not sleeping well. I have chronic insomnia. No. How do you know if you have chronic insomnia? You have to look whether more than 3 nights in a week, okay, 7 days week, more than 3 nights, are you sleeping? If you're not sleeping well for more than 3 nights, and it's been happening for more than 3 months, then you have chronic insomnia. So it's not like you have exam this month, 2 weeks you're not sleeping, you're not suffering from chronic insomnia. Don't worry. So it is if you have sleep issues for more than 3 days in a week, every week for 3 months or more. Okay, so that we have to look into. Okay, sometimes you have something called as comorbid insomnia. Comorbid insomnia basically happens when you have other diseases, other issues which is disturbing. Suppose you have asthma, you're not able to sleep because you're having breathing difficulty. Okay, every night you're waking up and you're having difficulty in breathing, so you're not sleeping. So that is comorbid insomnia. Or you have chronic obstructive pulmonary. Okay, unlikely you will have. It is a little aged disease. Okay, or you have sleep apnea. Sleep apnea is, I don't know if you might have noticed, some of your roommates might be snoring so much that both the snoring person and yourself cannot sleep. So I'm talking about the snoring person. He has apnea. Okay, so apnea is a condition where the other person sees this, hears this person snoring, but his sleep also gets disturbed because that snoring is because of an obstruction. That sound is produced because somewhere around along your airway there is an obstruction. So that's why that sound is happening every time he or she breathes. Okay, so that when that happens, it reaches a point where their brain feels, okay, I'm not getting enough oxygen. Hey, wake up, breathe properly. So in between the sleep, they might not be aware of it, but they keep waking up in between. So that disturbs sleep. So these are some of the examples of comorbid insomnia. So if you don't have any, if you have comorbid conditions, we have to treat that to treat your insomnia. If you don't have comorbid conditions and you're only having insomnia, some of the other things that you should look for are these. Okay, like I told you, acute insomnia can occur when you have a life stress. Okay, you have a stressful event, like I told you, you have a breakup or exams or whatever. Okay, that is very stressful. Okay, uh, your parents might find it a good riddance, but it is stressful for you. So it is a stressful life event, and it is affecting your sleep. So it is very important to you. What will happen is, you're not sleeping day one, you're not sleeping day two, you're not sleeping day three, you're not sleeping day 3, you're not sleeping. Finally, what happens is, you spend your time on the phone, you spend your time talking to your friends saying, oh my god, I'm still upset about the breakup, or you watch rom-coms and console yourself, or whatever. You're spending time in bed not sleeping. Finally, your brain is very similar to animal brains. What do you do when you buy a pet cat or a dog? You want him to poop here, you take him every day at one particular time to a particular place and try to train that animal to do a certain thing in a certain place. So, our brain is also an animal brain. So, what it has learned over time is that, okay, bed is for sleeping, I go to bed at this time, and I'm expected to fall asleep. Okay, what happens is, because of this unfortunate event, you're not sleeping for a few days, but your brain starts, because you're busy thinking, "Cheh, I'm not able to sleep in bed. I'm not able to sleep in bed." You keep thinking this, and your brain begins to associate your bed with not able to fall asleep. Okay, which is very dangerous, because now when you go to bed, your brain thinks, okay, this is time for me to stay up, for me to call my friends and cry, or watch movies, or use my phone, because that's what I've been doing for the past few days. And your brain starts to think like that, it becomes trained like that. And when this happens, you get something that is called as conditioned insomnia. You're conditioning your brain to work like this. It is no fault of your brain. You have no disorder that is preventing you from sleep. You have no issues per se that is actually affecting your sleep. But unfortunately, you end up having chronic insomnia. Once chronic insomnia sets in, it's very difficult to get out. It is difficult to get out. Okay, so basically, when this excessive in conditioned insomnia, what happens is, the person is actually very stressed. Now that person has forgotten about their life event. They have probably gotten over their exams, they're probably found a new boyfriend, or they have whatever troubles they're happening, everything is over, but now sleep is their major issue. Now they're sitting in bed every day. Oh my God, I'm not sleeping. Oh shit. It's like 10:30. I've not slept. It's 11:30. I've not slept. It's 12:30. I've not slept. And this worrying pattern turns into a pattern of rumination. Like, you're repeatedly thinking, your brain is full of thoughts. There is something seriously wrong with me and I'm not sleeping. And when all this happens, what happens? You tend to fall asleep unexpectedly. When conditioned insomnia sets in, we have to be very sure to identify it and break that pattern. That's what you have to try. Okay, and I'll tell you how to do that. Hmm? Um, has this happened to any of you? No, nobody's ever had any acute stress events or hurtful situations that's obstructed sleep. Okay, good. Okay, poor sleep patterns can also, like, in my when I was talking about conditioned insomnia, first I told the person was sleeping on time, waking up on time. Okay, unfortunately, that event had disrupted everything. But sometimes it happens that we're habitually not someone who falls asleep at 10 o'clock and wakes up at 6. We will be like very casual about our sleep. Sleep is not so important. Like when we are hungry, immediately you rush to the fridge, or Maggie, 2 minutes, something has to be done, because your tummy is screaming. But sleep is something we generally tend to compromise when we have better things in life to do. So if you have an inconsistent sleep routine per se, you're very predisposed for insomnia disorder in the future. When we are young, our sleep hormone, basically melatonin, is our sleep hormone. Okay, so it is secreted by the pineal gland, and that hormone is what uh, actually acts as a lullaby and puts us to sleep. So when we have inconsistent sleep time, it is like, you keep turning your watch ka screw, and finally the watch doesn't know whether it's 4 o'clock or 5 o'clock. So our biological clock screw gets twisted every time we follow an inconsistent sleep pattern. So clock has to work properly. It needs a proper reset. It has to be. If it goes in a perfect order, it will work in a perfect order. So maximum, like, avoid inconsistent sleep patterns, be it a Sunday, be it, I know even I love sleeping in on Sundays, but um, in this talk, I will say you should not sleep in on Sundays, but generally we should not have inconsistent sleep patterns. Uh, Unfortunately, this pandemic has brought in a lot of insomnia situations, primarily because of this. What happens is, our college timings are haywire, school timings are haywire. Otherwise, my kids included, I used to have to wake up at this particular time to send them to school, and they have to wake up at this particular time to reach school at this, every day this assembly by 8 o'clock in the morning. So that was, that kind of, their biological clock was also running based on that timetable. But unfortunately, now they have online classes, because watching too much phone is bad. They have only 2 sessions per day, which starts in one session starts at 9:30 to 10, and another session from 10:30 to 11:10. Bus baki time they're free. So their sleep schedule is, I was initially finding it very difficult to make them wake up there. Like, I have time till 9:30 to take a bath, wake up. I can afford to wake up later. So that, in college students it's even worse. They don't sometimes, sorry, I shouldn't be telling this, but people come and tell us, that I have cousins who go to college, and they just attendance is the only reason why they even click on the link. It is because at that age we don't think it is too necessary to attend to boring lectures, but sleep patterns should not be affected because of this. Attendance, yes, it's a short term thing. I'm not telling you to bunk classes, but sleep has to be correct. Okay. Next, when I'm taking talk on education, I will definitely instill the importance of attending classes, but this time sleep. Okay. Then environment has a lot of role to play in affecting our sleep. For example, if you're sleeping in a room which is very cold, it's like so chill that you can't, you wake up in between sleep. Usually our body temperature is fixed. It doesn't go beyond a temperature range, which is why when we have fever, they check our temperature and tell us it's beyond that normal range. Okay. But when we are in REM sleep phase, we are like frogs. We are poikilothermic, as in they cannot control their temperature, and their temperature depends on their surrounding temperature. So at that phase, what happens is, if our AC is too cold, or temperature outside is not to our convenience, we will wake up. It will be really distressing and disturbing to us, and it affects our sleep. Okay. So we have to look that if we have sleep issues, try to make our bed comfortable, clean, where and you have a dim lit room, all those things. I'm telling you this because I've personally I've seen kids have problem when roommates are sitting late at night and studying. The other person has difficulty falling asleep because some children prefer to stay late at night and study, while others prefer to wake up early. But we should always try to understand the other person is trying to sleep. So it is difficult to fall asleep if lights are not off. Why is it difficult to fall asleep if lights are not off? It is only when lights are off that the hormone that I told you, melatonin, which is part of our biological clock, it gets secreted. Which is another reason why, if we use mobile phones at night or we sit with our laptops at night, we will not fall asleep. No matter how boring the session is on the phone, you will not fall asleep because the backlight of our phones and our screens are generally high intensity. compared to usual. Now they have options for eye protection and all that, but still the light is directly focused on our eyes. Okay, so it is the nerves that go from the eyes that go and tell the brain that light is off or on, and definitely they will say, because we're staring at light, they will tell the light is on. So it is considered, once light is on, it is daytime. So it is not time for melatonin, and we will not henceforth have sleep. Sleep issues have rampantly risen after the invention of our electric bulb because of this reason. Till then, our forefathers used to wait for the sun to set. Once the sun is set, they had the few candles to light up for some more time. After that, it was bedtime. But with revolutions, first electrical revolution followed by digital revolution, all this is affecting our sleep. Okay, so how much ever revolutions come, biologically, since we're still the same, we still depend on our little melatonin from pineal gland to sleep. So we need that. Otherwise, I'll have to prescribe you that. So it's better to have our brain working than my pen working. So focus on dim rooms. Try to unwind before sleeping. If you're really worried, you're tense about something, unwind in a soothing environment and then go to sleep. Okay. Okay. Now, lifestyle is another aspect that has affected our sleep patterns. Okay, substance use, be it alcohol. Okay, now when I say alcohol, everybody will say, I have alcohol and then I have good sleep. Yes, you have alcohol, you have good sleep. But what happens when you don't have alcohol? You will not have sleep. Your brain is very cunning. It wants to preserve all the energy it has. It is the best manager that you can ever meet. Okay. It is like I told you earlier, if you don't sleep, your brain will not clear its junkyard. Okay. I will not decide when to send, what to send to your long term memory. Similarly, if you give alcohol, alcohol will put your brain to sleep. Okay, it is seen as depressant. It puts your brain to sleep. So brain is very happy. Now I don't have to work, and melatonin has not need not be produced. This chap is drinking alcohol. I can sit comfortably. He will go off to sleep. So gradually, brain becomes very lazy. It will stop producing these things and working according to the clock. So when you stop alcohol, like you had alcohol for 3 months and you stop alcohol, you decide, okay, it's time I quit, and you stop alcohol. Brain is like, no, I have stopped working now. Now either you give me alcohol to sleep or you suffer insomnia. It is not going to do your bidding. So that's when they'll come. I tried stopping alcohol so many times, but because I couldn't fall asleep, I had to have alcohol to fall asleep. Gradually that becomes an addiction, because even if the person doesn't want, he's not able to sleep without alcohol. Even with sleep medicines, alcohol, when insomnia is triggered by substance use, it is very difficult to bring back sleep. Generally, if we give, like, 0.25, zero point 0.5, someone like me who drinks alcohol regularly, still finds it difficult to fall asleep. And all, I give 1 mg, 2 mg. People who drink alcohol regularly still find it difficult to fall asleep. So that is because the brain stops responding to lower quantities of sleep medicines. I'm so sorry. So brain stops responding to sleep medicines and all that. So which is very dangerous. So so you might think, okay, now alcohol puts me to sleep. What if I use meth? It is not something that puts me to sleep. It is something that stimulates me. I can study better. I can do that. I get all stimulated. But it does exactly the opposite. Meth will. Sorry, someone's calling. I'm so sorry. Meth will stimulate your brain so much so that it goes into a hyperdrive. That's how it damages the brain. It just puts your brain in such a it is a stimulant, and it stimulates more than normalcy, to the point that nerves suffer toxic death. When it gets stimulated like that, the person is so excited, the brain is so active that the brain cannot soothe itself to sleep. Okay, when you're like in the middle of a lot of activity, can you fall asleep? No. Same way your brain cannot fall asleep. So most of the other stimulant drugs, be it coffee, be it casual Red Bulls, anything that has caffeine, be it cigarettes, all this will affect your sleep. Okay. So even coffee, if you're someone who has sleep issues, it is better to avoid. Okay. And if you must have, earlier the better. Okay. So those are few things. Then there are some things that you cannot control. Like suppose you have anxiety disorder, you have depression, um, you have nightmares, you have OCD or mood disorder, psychotic disorder. Um, Such mental health issues can cause sleep disturbances, which we'll have to treat the underlying disorder per se to improve your sleep. Okay, but it has to be identified because most of these issues start with difficulty in sleeping. So, and most of these issues improve also once the sleep pattern improves. Okay, which is why even medicines we focus on sleep a lot. It is very important for your mental health. So you'll think, oh, it's not that important for physical health, it's important for mental health. No, it is very important for physical health also. Even cardiac issues, everybody's scared of heart attack. Everybody thinks, people die of heart attack, people die of heart attack. Do you know what causes this is out of my topic, what causes maximum death among my audience, 15 to 25 age group, young adults? Any? Okay, Maya ma'am wants to try. I can't ask anyone else. Any idea what causes max?
No. Any cardiac arrest, since you just said it.
Cardiac arrest is generally for maybe us and older, but not for them. Generally,
Okay.
young people die because of road traffic accidents, and most of them because of substance use. Second, they die because of suicide. Okay, so these are two preventable deaths. They're like literally in our hands. We just like somewhere it is because we didn't try at some point. So it makes everybody around them also guilty about it. Okay, so unlike heart attack or physical illnesses that cause death, these two cases are very abrupt also. You don't expect it at most of the times, and it is very difficult for everyone around to accept it also because of the abrupt nature. Okay. I always talk about something about these things when I'm talking to young adults because it's very close to my heart. I have seen people lose people, and it is very traumatic. Okay, now back to sleep. Physical conditions that cause one, yes, if you don't have proper sleep, cardiac issues can occur, your BP fluctuations can occur. Basically, like I told you initially, like NREM sleep, your BP levels, your pulse rates, everything, heart rate, everything goes down. Your body actually goes into resting phase. You have all this munis in the Himalayas and all who go into, there's so much of meditation, they literally go into a phase similar to hibernation, where for days on their metabolic rate is very less, and thus they don't age much. So if you want to look pretty and less aged also, sleep is the answer. Okay, so all these things are important for sleep. Then in the as you grow older, a lot of other conditions can also affect sleep, like dementia. In young, hyperthyroidism. Some people have issues because of RLS. I don't know if you know about this condition. It is called as restless leg syndrome. Okay, people tend to move their legs like this in sleep. In between, it will be still for some time. In between, they just move, and this movement arouses the sleeper from sleep. Okay, so it is distressing and disturbing for that person. But once you treat RLS, his sleep generally improves. Okay. Now, do you want to know if you have sleep disturbances, ma'am? Can you upload a form? This is basically a insomnia severity index. It has 7 questions. You can try answering them on your own, and maybe I'll give you like a 5-minute break, and you can try. It's just for self-assessment, so that you can know if you have any sleep disturbances or not. The link has been put in the chat box. The Google form link
I'm
has been.
just presenting it right now. Just one moment, ma.
Guys, kindly go to the chat box. The link is there. You can click on it and you can submit it. You can see the score as well. So like you see in the first question, so near your option there is the mark. So you just take that point and then add up all your points at the end, and then that will tell you about your insomnia problem.
Should I move ahead or like the first one is fine?
Yeah, if you could show till the end, because that's where the score is,
Yeah.
like the rating or whatever. So you can just on your own you can realize, and at the very end there are the guidelines for scoring or interpretation. So
Which is very simple, very straightforward. You just have to add up your scores. I try to make it simple, thinking about my MBBS students, but ma'am said here everybody is good at maths. They can do the calculation themselves.
we are engineers,
Yeah,
and
I
there are
know.
only 7 questions. That's why.
Much easier than the forms you sent.
Let me know when to stop sharing.
We can give them like 5 minutes to 7 minutes, and then I will go into treatment. So it's what to do, what not to do, and
Okay.
then we'll have question answer session and wind up.
Okay.
Okay, you can stop sharing. I think people have done faster than I've expected. So I guess I will move forward with my talk if it's okay with everyone. Okay. Um, Basically, how to treat insomnia. Insomnia you can treat through methods, like for most psychiatric conditions. One is psychological interventions, and the second one is pharmacological intervention. Pharmacological intervention is pretty straightforward. You're prescribed a pill and you pop the pill and you fall asleep. Okay, less commitment required on the part of the patient and the physician. Psychological interventions, um, basically, it is not for someone who expects a quick fix. It is a very slow process. Psychological interventions basically what we refer to as therapy. Okay, so we train that person how to overcome insomnia, and it doesn't happen overnight. Okay, whatever I'm going to say, also you'll find, oh, this I've heard many times. There is nothing to it. It is very difficult. But what we do in therapy is we basically push the person, motivate the person, support the person through the journey, and go forth with that. Okay, so it is a very slow onset of action. Okay, therapy, if medicines, if I prescribe today, you will start sleeping from today, and if at all you don't sleep tomorrow, if I adjust your dose, you will start sleeping. Okay, but I will never recommend it for someone your age. Okay, so because you're very young, and if you resort to sleep, if it is acute or if it is a short duration, yes, no problem. You're having a stressor you have for some time. Once the stressor goes, I know your sleep problems will also go. But or if you have any comorbid other conditions, yes, if it is simple conditioned insomnia, or if it is just your sleep issues are because of your environment patterns and all that, better way is through therapy, where although it is slow in acting, it may take several weeks for you to start getting proper sleep, you will have a consistent improvement. Okay, if you follow through, your sleep will gradually improve, and on the long run, studies have shown even after 36 months, your sleep is improved. Sorry. Airtel is keeping on calling me. I don't know why. Okay. So that's how it goes with therapy. Okay. So therapy requires to be, for therapy to become successful, it requires a lot of commitment from the patient side and also the physician side, because the doctor has to sit with you and literally teach you how to do it. Okay. And um, it is not easy for the patient, but it is definitely a good option. Okay, so what are the options that we have in therapy? One is CBT, cognitive behavioral therapy, where we help that person identify where there is dysfunctional sleep behaviors, or they have distorted thinking or disrupted thoughts about sleep. Okay, for example, there are people who come when their sleep is chronically affected. They come and say, sometimes I feel like a failure because even simple things like sleep, I'm not able to do. Everybody can do it. Even that simple thing about falling asleep, I'm not able to do. It is not failure. You just have to look at it as another challenge, maybe. Another way of looking at it. But it is not, see, I can sleep comfortably. But why do you feel sleepy when you have a big meal? Is because all your blood circulation from your brain immediately goes to your gut. It goes to your tummy because the digestion has to occur, which is why, post lunch school sessions or college sessions are generally met with very drowsy eyes. So, ma'ams, I request you not to take it out on children because it's not their fault. All their blood is in their gut. So, but at night, the issue is that just makes us a little drowsy. We need a comfortable, refreshing kind of sleep. That will not happen if you have a heavy meal in your tummy and you go to bed. Your tummy is moving around. It's all, it's bulgy and bulky, and you might want to pee because you're, full. So all these things will also affect your sleep. So don't do that. Okay. Next, the other things that we talked about, like cigarettes, smoking, or coffee, all these things will also affect sleeping. Then there is a misconception that if I read in bed, I will fall asleep. No, it doesn't happen like that. Maybe with textbooks, I don't know, I'm not sure, but generally, if it's reading for, you want to read and you like to read, you read, you are indulging in an activity that you want to stay awake with. So you should avoid doing it in bed. You should, you know, read, then go back to sleep. Okay, so don't eat in bed, don't read in bed, don't exercise in bed. Um, don't talk on the phone in bed because you're trying to stay awake to talk to your friend. Don't do that in bed. And never watch a movie in bed. Okay, these are some of the things we all do, but those things are not good for your sleep hygiene because, like I told you earlier, your brain will associate wakefulness with your bed. Okay, and if we are someone who lie awake and worry in bed, your brain again associates with the thinking process, associates the bed with the thinking process, and you end up staying awake in bed. Okay, so how can you relax before going to bed? If you want to unwind, to relax, what are the things that you can do? There are various relaxation techniques. If you Google JPMR, um, it is a standard Jacobson's progressive muscle relaxation. It is a standard technique that Google, YouTube, and all has videos of how to go about doing those exercises. Sometimes we train the person in therapy. Okay, then there is guided imagery. Guided imagery is basically we teach the person to think about a peaceful place. Maybe if you're thinking about the beach, you can maybe put white noise of beach, the waves or something on your phone, and think about it. That's where you have smell, or if you know you want, okay, I'm in the spa, if you like it in the spa, you can put maybe gentle whatever, Carnatic, I don't know what kind of music they put in spa, but so whatever soothing smells, these kind of things also, with eyes closed, if you imagine yourself in a very soothing environment, it tends to relax. Okay, I will is there time to teach a quick breathing exercise and I'll wind up. Okay. Okay. So this is something you can do. Lie supine. Okay. And first step is to lie supine and breathe. Okay. Either with your mouth or your nose comfortably. Okay. Take a few breaths gradually, and you should start feeling how you're breathing. Okay, and once you do it a few times, you will realize there's a rhythm to how your breathing is going. Okay, slowly. And now you should focus. Generally when we breathe, we'll every time somebody says breathing exercise, pranayama, don't do that in bed. Okay, you have to try to breathe with your abdomen moving more than your chest. It takes a while of practice to get used to that. So you have to try to breathe with your abdominal movements rather than your chest movements. Okay, and between each breath, give like a 30-second pause. Okay, and focus on how the cycle is going. Is it smooth? Is it still turbulent? Do it till it's smooth. Okay, follow it through till you are able to smoothly do that with your tummy up and down. It's not easy. It takes a while, and it helps to tone your abdominal muscles. So if you want to lose a belly, it helps in that way also. Then focus on the air moving in any part. It could be you can focus on the air moving in through your mouth or your nose or your lungs or whatever, but focus on that and the rhythm. Okay, slowly visualize all your disturbing thoughts gradually floating away, and do this process, continue this till you fall asleep. Ideally you should practice it for like 20 minutes every day for 2 weeks to learn how to do this. After that, only attempt it in bed before sleep. Don't go today and move your belly up and down. No, no. What will happen is you will not be able to fall asleep, and you will associate sleeplessness with this exercise, so which is very dangerous. So don't do that. You have to master the exercise, which takes a while. After that, you can use it in bed. And if you do it once and you're not getting it right, or you're not able to fall asleep, don't do it again and again. Just leave it that day. You can do it again the next day. Okay, get out of bed, unwind. If you're not sleepy, there is no way I'm falling asleep. Okay, take your mind off, get off the bed, go to the chair nearby and sit and read a book or your textbook. And when you're really sleepy, go back to bed. Okay, this is, I hope you will all try and follow this, and maybe in the future improve your sleep, if at all you have sleep issues. So I guess that's about it that I want to discuss today. If you have any questions, I'm open. Thank you.
Thank you so much, ma'am. And guys, if you don't wanna unmute, you can always ask in chat. And it was a great session. There were so many insights, which I mean, how our brain works and how it's an animal brain and all. It's all like new to me, completely new to me. I'm sure a lot of things are new to the students as well, and I hope they can train their brain to work the way they want it to. So, guys, any questions? Anybody, please ask in the chat, or you can unmute as well.
Hello, ma'am.
Hi.
Hi, ma'am. I just wanted to say thank you so much for that session. Like just like my ma'am said, I got a lot of insights from it. So personally, I am like I don't know. Yeah, according to the conditions that you said, I think I qualify as a person who suffers from insomnia. For me, it's the part where difficulty initiating sleep than maintaining it. So yeah, and you gave us a lot of insights, and also one more thing which I would just like to say appreciate is the way you say things. Your style of talking is amazing, ma'am. So just wanted to add that on also. So yeah, ma'am, I just wanted to ask like one question regarding the insomnia. It's
Please go.
like especially I have this when I think I am having sleep issues. When I fall asleep, I think like okay, I should sleep. I have to sleep. I do plan. I may have time. Like maybe I go to bed at 11 and then I plan to wake up at 7 or 6 or something. I know I have this much time. Okay, but the thought that I should fall asleep doesn't help me sleep. I'll be like, okay, I need to sleep. I need to sleep, and then I try to think of something else also. I'm like, okay, maybe I try to think of something else other than thinking about falling asleep. But this goes on for hours until maybe sometimes even till morning, and then I'm like, okay, now I give up. Maybe that's when I fall asleep. When I like stop thinking about it. So like, how do you break this pattern?
There is something called as paradoxical training. Now, I didn't mention that in my therapy because it's not. There are not many people it is applicable to. But probably you're one of those people where in paradoxical this thing what we do is we teach that person not to think about falling asleep, like just what you said, not to try to. And another thing that you have to yours. There's something called a psychosocial insomnia. In that also this thing happens, where when you actively try to fall asleep is when you have maximum difficulty. They say that the minute I got out of bed and went to watch TV, I gave up all hope and I started watching TV. 5 minutes into watching TV, I fell asleep. Generally, you don't fall asleep like that, but this happens. One thing that you can do is, like I told you, just next to the bed, you can keep everything ready. That okay, mm, if at all I fall asleep a little late, okay, I will accept that I might fall asleep a little way late, so I will prepare in advance for tomorrow. Okay, which will like relax you. Okay, if I fall asleep also I can sleep in a little bit also, so you will feel a little prepared. You'll feel less anxious about oh my god, I didn't fall asleep at 8. Now if I don't wake up at 6 tomorrow, I have to be out by 8. So those kind of, if that's a worry, you can tackle that, like maybe take your dress out and keep, and focus on all those things. So, and then try going back again. If you're not able to fall asleep, go put something next, put if there's a couch next to your bed, sit there and do some, something that you feel is productive, do something like that, and then attempt again, rather than sitting in bed and keeping on doing the same thing again. You're don't
Okay.
keep attempting falling asleep.
Okay. Okay. Thank you.
Welcome.
Ma'am, there's a question in the chat box. I have tried JPMR before, recommended by my psychologist, but some sometimes that too makes me anxious. Muscles feel too much strange, which doesn't let me sleep. What can I do then?
JPMR, were you trained to do JPMR with the psychologist, or were you just given an instruction?
It was given by an online. It was through a YouTube video only. It was not a face-to-face thing.
Generally, yes, YouTube video is an option. Even I said that because I can't train you people directly, but ideally, somebody has to see you getting trained with JPMR properly. Because if it's not done properly, I mean, the way, I don't know if you're tensing and relaxing your muscles properly. Because how it is done when you're relaxing per se, like when you in JPMR, you intentionally tighten your muscles and then you relax your muscles. Okay, so you should be taught how to relax, and appreciate the loss of strain. I don't know if that was done. If that's not done, you will not be able to relax.
Yeah, I was
The whole
given just the idea of how to do it online, so I think that's where we
it
went
is a
wrong.
little I think the issue was with the training of the exercise. It's not when you don't have any options, everybody does that, like, you can't have the person next to you, but ideally if you go somewhere and somebody does JPMR on you, like sits next to you and talks it through, now do this muscle, feel your muscle tightening, then feel your muscle losing that strain, and appreciate each of those muscles individually. What happens is when we do it alone, we tend to like rush through the process. So that will not give the desired effect. You have to go through it very slowly, and it's a little difficult when you're doing initially. Like JPMR is more complex than the breathing exercise. The breathing exercise is, I told you, is very simple, but that I told you requires 2 weeks of training for 20 minutes before you attempt in bed. So it is the same way with JPMR. JPMR requires more training.
Mm.
So unless you are properly trained to do it correctly, you do it in bed, it has the negative effect. Like I told you, you will associate sleeplessness with it. Then it becomes even worse.
Okay, okay, thank
Do you
you.
understand what I said?
Yeah, yeah, I did.
So that's the issue there.
Okay. I'll try something else then. Thank
Try
you.
breathing exercise. It's a little simpler than JPMR.
Oh,
See if it works. But like I said, you have to practice it separately for at least 2 weeks to uh, be able to do it in a calm way. You shouldn't be conscious of what you're doing. It should come automatically to you.
mm. Thank you.
And JPMR has a lot of steps. By the time you learn all those steps itself, it takes a while. You will not get calm if in between you're checking the video, what is the next step? In between you're checking again, what is the next step? So you have to learn that whole exercise, you know, to actually put it into practice if it has to benefit you.
Oh, okay. Thank you.
You're welcome.
Any more questions, guys? You can always put in chat. No. Please do fill the feedback form. It's important for the speaker and for us also to grow. So please do fill the feedback form. Thank you. Thank you, ma'am.
Ma'am, I have one more question if anyone else is not having another question. Like,
Sure, go
can I
Yeah,
ahead.
ask?
go on.
Okay. So, ma'am, I have this difficulty of also retaining whatever I learned. So, I think if I got it from your session that it might be related to sleep, where you said it goes to your long-term memory because of when we have a good sleep. So, if you having, I think I might be having this issue since I was in school and now I passed out of college. So, and it is getting progressively worse that I'm not able to retain information of what I read. So, is it something, it is probably something reversible, right? If you fix your sleep schedule and if you,
In your see, I don't sleep from my session. What I meant is sleep can be one of the causes. See, I cannot
okay.
tell you it is your cause because I don't
Mm-hmm.
know. I have not evaluated. It will not be right on my part to say that it will be the cause. If you correct your sleep, you will be okay. You have to
Mm-hmm.
see if you have any concentration issues. See, sleep will affect where is what I told you. Sleep, once you it has entered in your brain, from short term to long term consolidation is affected.
Mm-hmm.
Okay. Another way sleep affects is if your sleep is not good, the next day your functioning, your concentration, your attention, all the next day will be affected. These two ways sleep can affect. Okay.
Okay.
So, if there is any other psychological issue or attention deficit or anything else in your case, that will also have to be addressed equally.
Oh, okay. Got it. Got it.
Sleep is the only issue. Yes, definitely. If sleep is corrected, you will find a lot of improvement.
Okay. Okay. Thank you so much.
You're welcome. Hope that answers your doubt.
Yeah, I did. It did.
Thank you, ma'am. Thank you so much. I think all of you. Any questions? Anybody else? No? Yeah, it was a great session, ma'am. I mean, really, you spoke so well. I mean, full on, we were, and the way you described things, we could relate to each and every situation that you were talking about. So it's really nice. Thank you so much for doing this for my students. Thanks a lot.
Thank you, ma'am. And I'm sorry I didn't know a presentation was required.
No, that's okay. It was not even, the way you spoke. We didn't even realize the presentation was not there. It was so you kept us, I won't say entertained, but you kept us completely interested in the topic the whole time. It was really nice. It was very nice. The way you said everything, I'm sure it would relate to a lot of us who actually heard the whole thing. So it's very nice, ma'am. Thank you so much. Thanks a lot.
Pleasure, ma'am. Thank you.
Thank you. Thank you, guys. Thank you so much. I'll see you guys next week then. Thank you.
Bye, ma'am.
Bye.